Hi guys, I'm Michaela. I'm a first year physician assistant student at the University of Pittsburgh. I'm going to be taking over SHRS's Snapchat today. As a brief overview, our class graduating in December 2020 consists of 47 students, and we're currently in our last semester of didactic year, which consists of all classes from January to December, and then in January 2020 we start clinical. So as you can tell, it's Halloween, and our class was encouraged to dress up in costume or Halloween attire. I am dressed as the one and only James Conner. So if you guys have any questions throughout the day, please feel free to ask and I'll answer them when I can. Other than that, I hope you enjoy a day in the life as a PA student. I'm going to start off by giving you guys just like a little virtual tour of our new space. So it's been a busy couple weeks in the PA program. We just took our last exam of October, which is exciting. This afternoon we have our class called Diagnostics and Therapeutic Procedures, and this is where we do things like suturing and casting and incision and drainage and catheterizations, and it's more hands-on and a fun lab that we get to do this afternoon.
Guys, I'm Paige and I chose Pitt PA because I went to Pitt for undergrad and I loved it. I like that we start in January so I could start sooner after graduating, and we also work closely with many hospital systems around Pittsburgh.
So I just got home and I just want to tell you guys a little bit more about why I chose PA. So I always knew I wanted to work in healthcare. I really like the fact that PAs are able to diagnose and treat patients, prescribe different medications, assist in surgery, and help perform other procedures, all while helping increase access to healthcare. I also like that I have the flexibility to switch between specialties. So down the road, if I want to work in OBGYN or I want to switch to surgery or primary care, I have the ability to do that without having to do an extra residency or fellowship. So as you can see, as a first year or a didactic year student, we spend a lot of time in the classroom and in the skills lab. We learn about different diseases, their pathophysiology, how they'll present, what tests are done, and how we treat them. We also perform standardized patient encounters where we are given a chief complaint outside the room, and then we have time inside the room to talk to the patient, perform a physical exam, and then diagnose and treat them and give them the patient education that they need on whatever disease or injury they have. It's a really good way to prepare yourself for clinical year and for the real world when you're out working as a PA, and I really like that Pitt has that opportunity for us. So my class is coming up on the fun part of PA school, which is clinical year. Starting in January, we'll do 9 5-week rotations in different specialties such as primary care, emergency medicine, surgery, OBGYN, pediatrics, and so on. We also have the opportunity to pick 2 elective rotations. So back in the summer, we put our top 3 choices, and then our clinical year directors try to place us in the ones that we choose. My 3 that I chose were orthopedics, maternal fetal medicine, and dermatology. So I'm looking forward to see where I'll be placed next year. So the next couple snaps are going to be of my classmates and I partaking in different activities and opportunities in the community over our past year and as didactic students. Even though our schedule is very tight, 8 to 5, Monday through Friday, we do have time to have fun and get involved in the community as well as at the state level, just representing the PA profession.